Today I want to talk about another supplement option. Now, I know we talk about a lot of supplements, but hear me out here, because whenever we're choosing a supplement stack, we're choosing the things that are going to be best for each individual person. Even in my own life, I'm always looking for something that's going to hit multiple different areas of interest so that I can take fewer capsules, get greater benefit. So I'm always looking for supplements that are going to do more than one thing. Well, the supplement I want to talk about today is a supplement that is shown to be beneficial potentially for bone health, cardiovascular health, metabolic health, even potentially body odor. So this one is compelling to say, how impactful could it be, and what are the things that I'm concerned about? So stick around, because I'm going to talk to you about the research. I'm going to talk to you about who I think may want to consider using this, why they want to consider using this, at what dose, what the other potential benefits are. I also have a specific product that I want to introduce you to and a discount code. So wait for the end and I will demonstrate that to you at the end. And we'll go through all of the details so that you can feel informed and empowered about how to move forward with your own supplement stack. All right, so before I talk about what the supplement is, if you're finding value in this channel, please do me a favor and click that subscribe button. The more people that subscribe, the more people we can impact. So please help me help others by clicking that subscribe button. So what are we talking about here? We're talking about BLACKCURRANT, or Currant, depending on which side of the ocean you live on. So black currants are little berries that are native to Europe and Northern Asia. They're also grown in New Zealand. Now, you might ask yourself, why New Zealand? Well, New Zealand is known for great pasture land, but also for great soil. So you'll hear a lot of animal products coming from New Zealand because of the pasture land. Probably has something to do with the quality of the soil as well. And so the soil has great nutrients in it, and those nutrients come out in berries and different vegetables. So the blackcurrant, or we'll call it BCE, so blackcurrant extract. So BCE is rich in these compounds called anthocyanins. Anthocyanins are powerful antioxidants that have the potential health benefits through being anti-inflammatory, improving cardiovascular health, enhancing insulin sensitivity, potentially bone health, performance, and recovery. And I'm going to go through all that with you. But before I get to which product we recommend, let's talk a little bit about the research. So the first study I want to talk about is a study on bone health. Now, most people here are interested in bone health and they're always looking for what is that next thing that's going to help me to improve my bone. So fortunately, we have a study on BCE and osteoporosis. Now, this is a study in the right population, so peri and postmenopausal women over the course of 6 months. Now, not a huge study, but they did have 3 groups. They had a placebo group, low dose, and high dose BCE group, and they were able to look at some things around bones. So they were looking at bone mineral density, and they were looking at biomarkers, specifically P1NP and CTX and a couple of others. So their outcomes were actually pretty favorable. So they showed an increase in whole body bone mineral density. Now, notice what I said there. Whole body bone mineral density is not the same thing as looking at lumbar spine and hip, total hip, femoral neck, but it gives us a sense of what's happening. And there was an improvement in the high dose group. So that's cool. They also looked at the biomarkers, like I said, P1NP and CTX. There was an increase in P1NP, not really much of a change in CTX. And if you've heard me talk about these biomarkers in the past, you know that I'm interested in, if possible, reducing CTX and increasing P1NP. Now, that doesn't usually happen naturally, but if we can maintain CTX and increase P1NP, we're going to improve that P1NP to CTX ratio, and that's our goal. So it sounds like this is pretty promising, but as usual, the devil's in the details. And so how do we take this information and say, how powerful is this going to be clinically? Well, when you look at the improvement in bone mineral density, again, I already said it's whole body, not lumbar spine or hip. So I wish they would have done that, but they didn't consult me before they did the study, and I totally understand why. But in the future, if you're listening and you want to do a study like this, please do the areas that we're actually interested in from a DEXA perspective. It just helps us to understand how important. So how important is whole body bone mineral density? Is important, but it's not giving us all the information that we want. So we can't really say how important that is clinically. The P1NP increase is really interesting to talk about here. And you can see from the graphs that I have that the P1NP went up, but it didn't go up very much if you consider the starting point. So the percentage was good, but their starting point was really low. And this is interesting across the board. So when you look at these 3 groups, you can see that their CTX level was really high, well over 1,000 in the high dose group. And their P1NP was really low in the 20s. And this was true in all 3 groups. And so when you do a ratio on that, it's pretty abysmal. And you can see why. So this population is averaged age 51 in the high dose group, And in the other groups, you're around 53, 54. So you have about a 3-year gap. Now, that's not statistically significant when you do the statistics on this, but what's important here is that there are changes between a 51-year-old on average group and a 54-year-old on average group. So I think this was an error in the study design because they really needed to look at estrogen levels, how many of them are in menopause, how many of them have lost estrogen, is anybody on estrogen replacement, et cetera. This is a big factor here. In all 3 of these groups, the CTX level was actually really high. And in the placebo group and in the high dose group, it was over 1,000. So that's a lot. So I think that overall, these women were in a pretty bad starting point. And it's good to see, though, that this did have an impact. So the ratio did get better. P1 and P went up statistically significantly higher, but it went from like 20s to higher in the 20s. I would want it to go from 20s to 4x, like let's make it 80, right? So I think it does have an impact here. Is it the most powerful supplement I've seen for bone health? No, but what are the other things that it can do? So let's get into that. All right, so I think the second most impressive thing with the research around BCE is in metabolic health. Now, if you don't know much about metabolic health, let me just give you just a short little precursor here. So we talk a lot about cancer, heart attacks, and we're going to talk about heart disease later. But the underlying issue for most chronic disease is metabolic health. The underlying issue for metabolic health is insulin sensitivity. So insulin, the hormone that helps you dispose of glucose, if your cells aren't sensitive, meaning that they don't work well with the hormone insulin because it's been around too often because of diet or stress or whatever, insulin sensitivity leads to metabolic dysfunction, which leads to chronic disease. So measuring insulin sensitivity then is really important. What this study did was then to look at BCE in the 600 milligram dose over a short time period in overweight individuals. And so what they found is they found a 22% improvement in insulin sensitivity and a reduction in what's called postprandial or after meal glucose levels by a little under 10%. Now, what's also compelling about this study is they found a reduction in CRP or C-reactive protein. Inflammation is also the root cause of a lot of chronic disease. So those are pretty compelling findings for a supplement to reduce insulin sensitivity by that much. All right, before we get to the cardiovascular health, I want to just mention that if you've been watching this channel for a while and you haven't gone to our masterclass or joined our HealthSpan Nation, these are 2 opportunities to either do a free masterclass to hear me walk through how we build programs, or to join our community, our HealthSpan Nation, where we have a weekly live topic-driven Q&A, an amazing community of people that are supporting each other and answering questions for each other and helping people stay on track with accountability. So if you haven't joined either one of those things, please look for the link in the description below, or if you're listening to this on a podcast, you can check us out at optimalhumanhealth.com. Okay. So this next study is on cardiovascular health. So this is a study from 2020, again, relatively small, 14, but well-designed, double-blind, placebo-controlled crossover trial. So these studies took around a 600 milligram dose for 7 days, again, short, but they were looking at both arterial function and venous function, the big vessels, the big artery, the big vein. And what they found is that there was a decrease in what's called carotid femoral pulse wave velocity. And that means the amount that the artery is doing this thing. And so that is a good thing. We want to see that. They also found what's called a reduced central blood pressure. So again, they're looking at the big arteries. And essentially what they're measuring is the amount that the arteries can expand and contract to accommodate for the pulse of blood that comes with each heart contraction. The stiffer the arteries, the more shear stress, the more they're going to develop plaque and have issues. So you want flexible, strong arteries, and BCE apparently can help with that. Okay, so this last study is a study that is a meta-analysis, and it kind of compiles a bunch of things. I'm not going to review the things that we've already talked about, but some additional findings in here that I thought were interesting is an increase in what's called fat oxidation. So if you've ever been on a weight loss journey and you want to lose fat, you have to oxidize fat in order to get it out of your fat cells. That's how we get it out of our fat cells and storage cells, is to oxidize fat. So it's called fatty acid oxidation. And so BCE apparently increases fatty acid oxidation during light activity like walking. So they say walking induced whole body fat oxidation. And they noticed it by 11% at the 7-day mark and at the 14-day mark by 17%. So the longer they were on it, the better. They also noticed reduction in blood pressure in some populations. And they also noticed reduction in body odor in some populations, different studies. The body odor thing I think is interesting, but the body is always trying to get rid of toxins. And the fact that this reduced these specific toxin, these specific odor-causing compounds, these volatile compounds, shows that it's probably doing something on the inside. Now, I don't really know what it's doing, and I'm not here to talk about body odor, but I just think it's interesting. So it does all of those things. So then who should consider this supplement? Well, I would say somebody that has bone health challenges or osteoporosis, somebody that has concerns around heart health, which, let's face it, should be most of us, somebody looking to optimize blood pressure, somebody looking to optimize metabolic health with insulin resistance challenges, or maybe somebody looking to do something about body odor. It hits all of those things. Now, is it the most powerful I've seen for any of those things? Well, I haven't looked at body odor much, but outside of that, there are other things to consider, but this is something that you're going to take 2 or 3 capsules of and can potentially have a big impact across the board. So something to consider. If you want to consider it, I'd like to introduce you to this company called Currant or Currant, and they are a blackcurrant extract company that I got introduced to through a mutual acquaintance, and I got introduced to some of the owners. It's a cool company, family owned. They grow all of their products in New Zealand, and they do a ton of research. They're very research forward. They have dozens of studies that they sent my way. They third-party test every batch. So it's a really cool company making a really cool product, trying to show the benefits that this particular fruit can have for the population at large. Another thing that they sent me, which I wanted to pass along, is that they have done some testing from a safety perspective. They took the dosing all the way up to 130,000 milligrams. I'll say that again, 130,000 milligrams. I'm going to be recommending around 600 to 900. And they didn't find any issues. So that's a whole lot of BCE. So I think we can say that it's probably relatively safe. I'm sure somebody is going to have an issue with it, but I haven't seen it in the studies. And the company also reports that they don't get much negative feedback. So the recommendation is to take 2 or 3 of these caps. That's going to fit the research. So 600 to 900 milligrams is sort of the sweet spot according to the research. That's what's been studied. Make sure you take this one with food. It's going to be absorbed better, but don't put it in hot liquids because it's going to deactivate some of the compounds within the powder. So if you want to try this, you head on over to their website. We'll put it in the description as well. It's called curranz.com. That's curranz.com, and use the discount code Dr. Doug, DRDOUG, and that'll get you 10% off of your first purchase. All right, that's it. That's all I have for you today. Please remember that a diagnosis of osteoporosis isn't the end, but deciding to reverse it is the beginning. Thanks for your time.